Good afternoon, everybody. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Welcome to our Tuesday, May 12th press briefing. Since our May 11th press briefing, we have had 164 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 5,274. Today, 128 of the 164 new cases are from long-term care facilities. These positive individuals are from 25 municipalities, none of which are reporting new cases. This keeps us at 61 of our 62 municipalities that are home to individuals with COVID-19. Today's individuals range in age from 16 years old to 104 years old. And as always, you can check our county map at montopa.org/COVID-19 for updated geographic information. Today we had 108 females and 56 males. 5 are known to be hospitalized. 38 are in isolation at home. We have a number that are in long-term care facilities, and the remainder are unknown. I'm also saddened to confirm that 12 more Montgomery County residents have lost their lives to COVID-19, which brings us to 429 deaths confirmed positive from COVID-19. 1 passed away in a hospital, 6 in a facility or residence, and 5 we do not have information on. These individuals ranged in age from 71 years old to 98 years old. Overall, we have lost 234 females and 195 males since this pandemic began here in Montgomery County. The self-reported racial breakdown: 12 Asian, 3 Asian Indian, 3 Asian Korean, 41 African American or Black, 110 white, and 260 unknown. Now, for probable deaths, and again, as a reminder, this is a situation where COVID-19 is listed as the cause of death on the death certificate, but we do not have laboratory confirmation. We have today 203 total probable deaths. So adding that to our 429 confirmed positive, that leads us to 632 total deaths. And as an additional reminder, we do often get confirmation of these cases subsequently, in which case they will be moved to the confirmed positive number. Our hospital bed situation continues to improve. Thanks to your good work at staying home and maintaining social distancing when you're out on essential travel or trips or work, our hospital beds now, or actually, let me rephrase that, the number of people hospitalized with COVID-19 is down now to the low 300s. This is very good news. We were steadily and in the 400s for quite a number of weeks. So it is great to see these numbers coming down. I do have to note, though, that we remain with about 25% of these individuals requiring ventilators. So even as these numbers come down, I don't want to lose sight of the fact of the very seriously ill people that still remain in our county hospitals. Our long-term care facility update today, we remain with 93 facilities that are reporting positive cases of COVID-19 among their residents or staff. In total, over this period, we have had facilities report to us 1,534 cases among residents and 564 cases among staff, for a total of 2,098 cases. Now, remember, these are not all Montgomery County residents, and so these numbers do not roll up into the big number that I shared with you earlier. But again, this is just our daily reminder of the very serious and ongoing challenge that is being faced in many of our long-term care facilities. As always, we want to thank the staff that are working so hard to take good care of these residents and make their facilities safe. Of our confirmed positive deaths today, 375 of the 429 confirmed positive deaths are long-term care facility residents. So that brings us now to 87% of our total confirmed positive deaths. We continue to do outreach to these facilities. Our field assessment and support team, or FAST teams, continue to go out and make visits. On these visits, they offer support, they answer questions, they check for personal protective equipment, make sure it's being used properly, and they offer guidance on testing. Earlier today, Secretary Levine recommended that long-term care facilities perform viral testing on their residents and their staff. And I want to thank the Secretary for making this recommendation. She stressed how important this is to getting an understanding of the situation with any particular long-term care facility. As many of you know, we have been working on this and recommending this to facilities in our county for some time now. And I think that this is an excellent opportunity to get additional resources to our county long-term care facilities. And for those that have not been able to conduct this testing, we hope that this will give them the resources that will enable them to do so. Our Montgomery County Correctional Facility remains stable. There are no new updates from today. All the inmates that have tested positive are currently stable. I do want to announce that since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency in Montgomery County, the population at the Montgomery County Correctional Facility has gone from 1,342 to 899 today, a net decrease of 443 inmates, which is a 33% decrease. This reduction in inmates has made possible a critically important ability to isolate and quarantine individuals who did test positive for COVID-19. And we want to thank everyone involved in helping to make our correctional facility as safe as possible. Our community testing sites are both up and running today. The Norristown Walk-Up Community Testing Site will be open tomorrow from 11 to 1 at the Delaware Valley Community Health Center in Norristown. This site is for residents of Norristown. Appointments will open up for Wednesday morning at 8:30 a.m. by calling 610-592-0680. The drive-through site at the Montgomery County Community College is also open and running smoothly, and we want to thank everyone in Whitpain and the Community College and everyone who's helping with that site, particularly the National Guard. We have now, since April the 16th, from April the 16th to May the 7th, tested 4,388 individuals through this site. We have received results on 97% of them, which is 4,252 individuals. 619 of these individuals are positive or have tested positive. So for 19 days, we have an average of 14.5% positive. But I'm happy to tell you that we are starting to see that rate of positivity come down in these last several days. The appointments for tomorrow, Wednesday, will open at 8 a.m. Wednesday morning, and they can be made at montopa.org/COVID-19 under the green County Testing Information button. You can also call 610-631-3000. I want to remind everyone an announcement we made the last couple days that the Rite Aid in Lansdale, located at 1856 North Broad Street in Lansdale, opened this week for COVID-19 testing at no cost for anyone over the age of 18. Appointments may be scheduled at www.riteaid.com/pharmacy/services/. COVID-19-testing. I want to give you an update on our efforts to reinstitute contact tracing here in Montgomery County. Our project is well underway. Last week, the county posted 4 positions for the Office of Public Health Contact Tracing Management Team, and they are currently interviewing applicants for the 4 positions that will make up this team. These positions include a senior and logistics manager, a field operations coordinator, a clinical coordinator, and a data coordinator. This team will work to implement the contact tracing plan and will refine the plan as needed during the upcoming year. The contact tracing plan will include the county partnering with local community organizations to complete contact tracing. The county will contract with these providers to manage a staff complement of contact tracers who will contact residents that test positive, complete contact tracing, and enter the resident into the SARA Alert system, which is a standards-based open source tool allowing us to efficiently monitor individuals at risk, enabling real-time insights and increased reporting capacity to support containment of this virus. We will be working with the Pennsylvania Department of Health on this. They are actually implementing the SARA Alert system across much of the Commonwealth, and we're happy to be able to partner with them on this work. So today we have a new chart to share with you that illustrates our success in the results of people staying home, practicing social distancing, and really starting to make some progress here in the county. So this chart has 3 sets of lines, of 2 lines each. The reds, the dark red and the pink line show our totals. The dark red line is our total 7-day average. The pink line is the total over a 14-day average. The blue lines represent the community. So the dark blue line is the 7-day average from the individuals in the community. The lighter blue line is the 14-day average of individuals from our community. And then the orange lines show our long-term care facilities, with that darker line being the 7-day average and the lighter kind of yellowish orangish line being a 14-day average. And that dotted line across the bottom is the 50 cases per 100,000 metric. That is one component of Governor Wolf's plan to move us from the red zone or the red phase to the yellow phase. So I just want to show everyone in a very graphic way the fact that your efforts are really, really making a difference. Particularly when we look at that 7-day average, you can see the big decrease that we've seen recently. And I wanted to particularly show that because we know from this, watching this virus now for a couple of months, that when people do not practice social distancing and one person goes out and infects 2 to 3 people, it takes about 3 to 4 weeks to see the full impact of that. Because then those 2 to 3 people each infect 2 to 3 more people, and so it goes. So it takes about 3 to 4 weeks to really see that full impact. And of course, the converse is true. It takes a while for the cases to start to drop once people do start to seriously practice social distancing. So I'm extremely pleased to see that 7-day average really starting to come down. We did get a pop-up today, but as I mentioned earlier, the vast majority of those cases were from long-term care facilities that are now starting to test all of their residents, which I think is extremely important. It does affect that overall number, but you can see very clearly here that we are tracking these in separate ways and are hoping to work with the Department of Health to continue to count all of these cases, since they absolutely have an impact on our resources here in the county, but to clearly distinguish between cases that are coming from our community, which still continue to be greater than the number of cases that are in our long-term correctional facilities. Now that could change as more testing is done, It's possible that over the next couple of weeks, we'll see more long-term cases than community cases. And I think that's okay. I think that when we have the data behind where our cases are coming from, it makes it much easier for us to advocate on behalf of the residents here in Montgomery County. So kudos to all of you. Our Montgomery County community must understand that we are in this together as a community. This virus, which can be unknowingly transmitted by people who have no symptoms, binds us together in a shared obligation to follow safe practices for our community as a whole. Even if you believe that none of this guidance applies to you personally, I am asking you to acknowledge your role in our community and your responsibility to be part of the solution. Together, we are beating this thing. That is clearly evident now. Every day, we get closer to a place where we can think about relaxing restrictions. But if we don't stay together, we will fail. Please be part of our shared goal to beat this virus and keep our community safe as quickly as possible. The decisions that people make today will determine the type of summer and fall that we will have. So please stay the course and please do it together as an entire community, and we will beat this thing. And with that, I'm going to turn over to Commissioner Lawrence.
Good afternoon. I'm announcing today that the second round of the Monto Strong Small Business Grant Program will open tomorrow. Montgomery County is making available $5 million in economic development funds to provide grants to eligible small businesses for round 2 of the Monto Strong Small Business Grant Program. Round 2 grants will once again be administered by the Redevelopment Authority of Montgomery County and the Montgomery County Department of Commerce. The $5 million available for the second round of the program includes funds from the Delaware Valley Regional Economic Development Fund and the Federal CARES Act. We want to thank the Delaware Valley Regional Economic Development Fund, chaired by former County Commissioner Tom Ellis, for their support of Montgomery County's small businesses. Updates to the program for round 2 include new eligibility parameters, strategically identified program priorities, and other changes that are being incorporated to make the program more equitable and also ensure more businesses have an opportunity to compete for funding. Changes include a tiered grant award system based on gross revenue, a maximum of 30 full and part-time employees, a greater emphasis on supporting minority, women, and veteran-owned businesses, and changes in the allowable uses of grant funds and business eligibility. Any business interested in applying should thoroughly review the guidelines to determine their eligibility and preview the application questions before preparing to submit an application. The updated guidelines, including a preview of the application questions, updated program fact, and additional information, is available on the program website at www.montcopa.org/MontoStrongSBGP. Links to the program webpage can also be found from our county's COVID-19 data hub at www.montcopa.org/COVID-19 and our Commerce Department's homepage, www.montcopa.org/commerce. For round 2, applications will be accepted beginning tomorrow at 10 a.m., Wednesday, May 13th, and the application window will close at approximately 6 p.m. tomorrow on Wednesday, May 13th. Applicants who applied in round 1 and did not receive a grant will need to apply in round 2 due to changes in the program eligibility and the new tiered grant award system. Those businesses who did receive a grant in round 1 are not eligible to apply in round 2. And we'd like to extend our thanks and appreciation to the Montgomery County Redevelopment Authority for their continued partnership with our Commerce Department on this program. Thank you. I'll turn it back to Val.
Thanks, Ken. All right, with that, I'm happy to take questions.
Our first question is from Jim Melwart from KYW. The State Department of Health is rolling out a plan to test staff and residents in congregate care facilities. What are your thoughts on the plan and how long it took for the state to enact it?
Well, as I mentioned a few minutes ago, I thank Secretary Levine for taking this leadership position. I completely concur with the steps that they are taking, and I hope that this will mean that it will bring more resources here to our county to help facilities that were struggling with the ability to get testing done. So I feel very strongly that we need more testing available. This is an extremely vulnerable patient population or population in our community. It does have impact on our hospitals as well as on the staff and their families. So I am extremely pleased to see this moving forward and hope it happens as quickly as possible.
The next question is also from Jim Melward from KYW. We continue to hear from business owners who say they feel that they could open their businesses safely, but feel they can't even open a dialogue. Is it time to open that dialogue for more businesses? Could the county facilitate talks with the state? If now isn't the time, when would be better?
Well, we're getting close to the time. As I shared with the numbers today, we are rapidly starting to get down to that level of cases where I believe we can make a strong and evidence-based argument that we can begin to relax restrictions on certain businesses that are currently not deemed essential. And I continue to urge all businesses to begin making plans, use this time wisely, particularly if you need to make modifications within your business or take other steps to be ready to open. And I am advocating for the people in this community every day and continuing to speak regularly with the Department of Health and want to make sure that when we do relax these guidelines, we are in a safe enough place as a community that when the inevitable increase in cases comes, because I'm certain that it will, we are going to have to learn to live with this virus, that we are prepared, that our hospitals are in a little bit better shape than they are now. They still very tight on supplies, on personal protective equipment and other things. We just want to make sure that we do this right, because it would be even worse, I think, to have to move backwards. So we're getting very, very close, but people have to stay the course. This is not the week to let up. We are getting there. I certainly want to just reiterate what Commissioner Lawrence said. If you're a small business in the county, please consider applying for our grant program. Hopefully these would be funds that would help tide you over a little bit longer until things are started to be able to be opened.
There are no further questions.
Okay. All right. Should we give it another minute, Todd, or do you think we're good? Questions?
We don't have anything else.
Okay. All right, then we will see everybody tomorrow at 3. We are planning to broadcast tomorrow at 3. Thank you. Thank you, Sarah.